In the DESTINY-Breast01 trial, patients have advanced HER2-positive breast cancer. They all received the Trastuzumab deruxtecan at the recommended dose of 5.4 milligram per kilogram. And in this ASCO presentation, we looked in particular into the subgroup of patients who had a history of brain metastasis. So this are 24 patients actually among the 184. The important, these patients have no active symptomatic brain metastasis, because here we are still waiting to have an idea how the drug works. So concerning these 24 patients, actually 17 had still lesions present when they entered the clinical trial. For 15 of the 17, we have the possibility to have results concerning efficacy. And we have seen that among the 15 patients, 7% the response, 7 have stable disease, and 1 has only progression of the disease. So this is in particular concerning the in-brain outcome of the treatment. So it's important to mention the overall response rate. It was about 60% in the CNS subgroup, which is similar to what has been seen in the whole patient population. Also, the duration of the responses was extremely long. It was about almost 17 months in the CNS subgroup, about 15 months in the whole patient population. But I should mention that all these patients had received prior treatment with T-DM1, and they had received a median of 6 prior lines of treatment. So seeing this long duration of response is really exciting. Also, when we look to the median progression-free survival in the patients with brain metastasis, it was a little bit more than 18 months. So again, really impressive if you take into account all the previous treatment. And then the last point concerns the new events in the brain. And here we have seen a total of 4 events in the 184 patients. 2 were in the CNS subgroup. Here, this was early events within the first 3 months. But we have also seen 2 events in the non-CNS subgroup, and there these were late events after more than 300 and almost 500 days after entering the clinical trial. The limitation of this presentation, of course, is the low number of patients with brain lesions, 24, and this is also a post-hoc analysis. So now there are 4 additional trials ongoing, including 2 very large international trials, where we are looking not only to patients with a history of brain metastasis, but also patients with active brain metastasis. In addition, we're also looking to combination of Trastuzumab deruxtecan with tucatinib in particular. And then we're also not restricting only to patients with HER2-positive disease, but also patients with HER2 low-expressing tumors, because there could be an interesting response. And finally, in some of these trials, we are also looking to patients with leptomeningeal carcinomatosis. So this is a very poor disease situation. And also there, maybe there is an interest to use this drug.